So the first thing is, what is your opinion about the current status of public health
Yeah.
when we look at Gulf countries, specifically Saudi Arabia, Qatar, Kuwait, Bahrain,
Yes.
and in that specifically with a focus on different domains of public health, for example, NCDs, communicable diseases, and the overall health system, how you would like to look at it. So, just a general overview that you have, and then we will
Yeah.
go in depth into one of these.
Thank you, Dr. Hassan, for inviting and on this stuff. So, when we are talking about the various opportunities in the Gulf countries, we can think of that they are maybe to some extent they are the same as with the other countries, and there are some opportunities that are specifically higher as compared to the to other countries. The good thing about Gulf countries is that it really is struggling, and they have found some good leadership, and they really want to explore, and they want to expand. And when we are talking about further expansion, it doesn't mean that they are looking for just the hospital and things like that, and because they do have, as in our countries as well, they do have a lot of hospitals, but what they are really looking at is the domains of public health, its application, how health can be taken as a system, how it can be controlled, how the service delivery can be controlled, rather than just struggling in the better service delivery and focusing on other
Great,
issues.
great overview. Just
So,
one thing I want your opinion on is
yes,
when you look at the issues of obesity,
yes,
when you look at the issues of non-communicable diseases on the rise here, especially
yes,
with the lifestyle that is here, sedentary lifestyle. What are the solutions on the table from a public health perspective that you can recommend to
yes.
governments here? Anything that you'd like to add?
Uh, I will say that yes, there are some challenges because that is due to their specific geographical area, their terrain, the lot of heat or coming here. So, due to those reasons, probably the movement is very much restricted. So people prefer, and then low prices of oil. So people usually prefer to go by their own vehicles, but it doesn't mean that we don't have any opportunities. There are some good opportunities. We can see that they have bit a flavor of the Mediterranean diet, and that is a good thing in them. Uh, they are also conscious. That is also a good thing. And the important thing is that how we go for advocacy, because over here the leadership is really committed, and if we can convince them, then we can expect some results. The first thing would be maybe because the area where I live, or which I have explored, or which is the majority of the area, if you don't talk about the cities, that is probably we need some parks and things like that, so as to encourage physical activity, maybe in the morning or some other specific time. But even those people who want to have in the night, you will see a lot of people, they are moving around by feet. But maybe if we encourage, so we convince our government, because they have a lot of money, they can build some such type of places, then maybe we come up with some better outcomes.
Yes, I think brilliantly put by you, and also adding into this, say we have this culture of cycling developed here. On top of that, indoor physical activities, a culture of that developed here that would revolutionize the non-communicable disease part.
Yes, exactly. So I think you have very excellently pointed out, if we go for some advocacy for cycling culture, that will really help us out over here.
Okay, and so in the next 10 years, I know that you have access to primary healthcare here. You have an understanding of the health system. So, uh, within the next 10 years, how do you see these countries progressing towards universal health coverage, towards a system where I know that the even if the people are paying out of pocket,
Yes.
still they have a high income setting here, so they can pay. But a system where it's a prepayment mechanism that can be deployed across Gulf countries,
Yes.
and people, as we know, move around from one country to another. So
Yes.
have a unified universal health coverage across them with unified standardization and simultaneously unified insurance mechanisms. So, your thoughts on that?
Thank you again. That is a nice question. I would say that we can look at this. If we are predicting for the future, then we may look at this phenomena from two angles. First thing, again, there is a lot of commitment. They want to go for that, and they can really hire technical people as well. There will not be an issue over here. Some Gulf countries like the UAE, especially Dubai and many, they have already excelled in that, and some are struggling still. I have heard about Kuwait. They are struggling in universal health coverage, and Saudi Arabia, that is a really expansion phase. But something we have to keep in mind when we are talking about universal health coverage, over here the level of taxation is very low. So again, the question will be from where, how we are rerouting the out of pocket payment to any other modality. Maybe that is something, because that if it is taking time, probably that will be the only factor. Because again, universal health coverage, we all know that that involves a lot of cost. And maybe if they go for some phasic manner, if I would say, for example, if they go for initially maternal health care, for example, because that is something very much needed, and everybody will agree to that, and then they raise some of the taxes, and then maybe people will get know to it that mm, this the taxes which is cut from us, it is not going anywhere else, it is going to be spent on us. But the issue is that I think it's in our countries they already take a lot of taxes from us. We only look at some phenomena, some services or some programs they can, who can really expand, who can spend on the public. Here they have no culture of giving the tax. So maybe that is an area where the governments might be needing a little bit of struggle, I guess.
Thank you so much for this podcast, for taking out the time from your busy schedule. We know that you have been involved in multiple researches and grants over the years, and we know that you are also looking for developing a culture of research here.
Thank
So,
you, sir.
thank you so much for being a part of this podcast. I'm very grateful.
Thank you, Dr. Hassan.